Hello guys, welcome back. Today we're doing the types of bacterial infection, symptoms, and more common. And more. We're going to be doing common to rare. So basically there were no rare ones that I could get, so I'm doing very rare ones. So I hope you enjoyed today's video. I hope you figured it out. This took me almost an entire hour to do. It's exaggeration, I did research. This is a total of 30 slides, which will make this video about 20 to 25 minutes. Maybe I'll try to make it shorter, so let's get to it, because I'm wasting time. Lyme disease is number one. A tick-borne disease caused by bacteria, you get that. This results in rashes, fever, and fatigue. So Lyme disease is actually from a tick. Now that tick kind of gets untreated, or it goes unnoticed, or untreated, it could cause Lyme disease, which could cause a lot of things. Lyme disease symptoms: rashes, fever, chills, fatigue, headache, symptoms of late-stage Lyme disease, numbness in hands and legs, arthritis, and short-term memory loss. So rashes could be like from the tick bite. You could start to get like rashes on your hands. Fever, it could be like a temperature, 100 to whatever. Chills, so it could be because there's always signs of an infection, and that's basically Lyme disease is an infection. You can get chills, fatigue, which is sleepiness. You're basically tired all the time. Headaches. Numbness in hands or legs, which you could end up going full-on paralysis. So that means full-on paralyzed from this. Arthritis, which is kind of like pain in certain type of body parts. It's a very bad condition. Not dangerous, but it's very painful and debilitating. Short-term memory loss. So it could be like you forget what you do. Short-term. Complications is arthritis, neurological problems like meningitis and nerve inflammation, heart problems, facial nerve inflammation, and Bell's palsy. So that means like facial nerve inflammation means it's not going to be the same. Their face basically won't be the same. Meningitis is inflammation in the brain, so that infection can basically spread to the brain. I'm not sure sepsis plays a role in Lyme disease, but I could be wrong. Like, I look up Lyme disease complications. Whatever comes up, I just put down. How many get it? Now, one thing I want you to know about complications is you're not always promised to get these, which is a good thing because you do not want to know what it's like to have meningitis. I don't want to know what it's like, but anyway. How many get it? It's very common. More than 3 million cases per year in the U.S. get it. That is very, very common. Cellulitis, a serious bacterial infection of the skin, usually affects the leg, and the skin appears as swollen, red, and painful. So basically the leg and all the body parts will kind of look a little bit weird. You basically will have this big rash on your hands or on legs, and it could cause really bad stuff to happen. So it is very, very serious. They even say to get urgent medical treatment because the complications are very serious. Cellulitis, symptoms is red area of skin that tends to expand rapidly. Swelling, tenderness, pain, warmth, fever, red spots, blisters, skin dimpling in severe cases, shaking, chills, fatigue, dizziness, muscle aches are seen. Now, what this to me looks like is already symptoms of sepsis. So if you already have shaking, chills, fatigue, dizziness, muscle aches all together plus these symptoms, it's automatically kind of like alright, is this sepsis? Do we need to treat this for sepsis, because sepsis is not something you want to joke around about because it is very serious. It can kill you in under 12 hours. So this is a very serious thing. Now already fever and warmth is already a sign that there's an infection that either red into the bloodstream is now spreading to other parts or is kind of getting to that point. So yeah. Complications is spreading of bacterial infection in the bloodstream, aka sepsis, which again is kind of like these symptoms right here, which goes with the infection. Chronic swelling in the limbs, so that could be like your limb is getting really, really big. Inflammation of lymph vessels, tissue death, or gangrene, whatever, yeah. How many get it? Very common, more than 3 million cases per year in the U.S., so it's a very common thing to get, but yet it's kind of dangerous. Strep throat. I've had this. It is painful as heck, let me tell you. A bacterial infection of the throat and tonsils that generally causes throat irritation. Tonsils are a pair of soft tissues masses which are located on each side of the back of the throat. So your throat will hurt. You basically won't be able to talk, won't be able to do anything really. You'll be in that much pain. Strep throat symptoms: sudden high fever, mild soreness in throat, redness in throat with white patches, headache, chills, loss of appetite, curvature lymphadenopathy, swollen lymph nodes in the neck, swollen tonsils, difficulty in swallowing food or water, pain when swallowing, nausea and vomiting is seen in younger children. So, basically what you'll have, headaches, is already a symptom of this. Now, so you can have sore throats without strep throat. You can also have difficulty swallowing because those are already symptoms that you're developing a illness or an infection such as the cold or the flu. Pain when swallowing, that's also a big, but if you have all these symptoms, it's best to get checked for strep throat. I know it's a very painful thing to go through because you basically have a sore throat while gagging, and it kind of makes it like hell to live. Excuse my language, but it's kind of true. But anyway, it's pretty bad. Complications: ear infection, sinusitis, rheumatic fever, or an inflammatory condition infecting the heart, joints, and skin. Inflammation of the kidneys, so that could be like a kidney infection because strep throat can lead to bloodstreams, an infection of the mastoid bone in the skull, mastoiditis, I don't know how to say it. Scarlet fever, scarlet colored rash all over the body, rheumatic heart valve disease, aside from the infection possibly triggering sepsis. So this I already found, so you already know it could cause sepsis. So right there's it's not something you want to go untreated because you could end up being completely disabled for the rest of your life. Strep throat is something that I don't think a lot of us take seriously that should do. How many get it? Very common, more than 3 million cases per year in the U.S. Rare types of infections. We're getting to the good ones. However you say this, what the heck is this? You guys may be wondering. That name, is a bacterial infection, most often, results from handling or eating raw or undercooked pork. It causes diarrhea and abdominal pain, but symptoms usually clear up without treatment. To prevent that, always ensure meat is cooked to a safe internal temperature and wash your hands thoroughly after handling raw meat. So this is very, very serious. I don't think any of us really want to get these type of infections that are going to be coming up here because these are not kind of infections you want to be messing with. Most likely because they can kill you and it's not a fun thing to go through. I don't think death, maybe you want to die, but going through death like this is not a good idea because it is painful as heck. So these symptoms: fever, abdominal pain, and diarrhea, which is often bloody. Now, bloody diarrhea, if it's severely bloody diarrhea, could cause blood loss and could cause you to go into shock. Now diarrhea, yes, I feel like this could play a role in giving you hypovolemic shock, which is the shock that you get when you lose too much plasma or fluids, which will make you too dehydrated. And when you get too dehydrated, it causes your body to basically not do so well, causing you to go into shock, which hurts all your organs of any type of shock. So just be ready that if you have diarrhea, just drink plenty of fluids, no matter what the cause is. Diarrhea is something that and we all know we take seriously, but not seriously enough because this can cause a shock known as hypovolemic shock. It's actually one of the main reasons babies die is actually diarrhea. Diarrhea is very serious because if you keep having diarrhea and not drinking your fluids, the more dehydrated you get. You could become so dehydrated you either pass out or you get into hypovolemic shock, causing an entire shock in your body, killing you almost instantly. So I would not recommend having that. Complications: joint pain called reactive arthritis, most commonly in the knees, ankles, or wrists. These joint pains usually develop under 1 month after illness begins and generally go away after 1 to 6 months. A skin rash called erythromenosum, on the legs and torso. The rash is more common in women and usually goes away within a month. So the complications really aren't too bad. But again, I think the symptoms is kind of the killer. But anyway, meningitis. Meningitis is an inflammation and infection and inflammation of the fluid and membrane surrounding the brain and spinal cord. Symptoms are headache with nausea or vomiting, decreased appetite, confusion or difficulty concentrating, sudden fever, severe headache that seems different than normal, seizures, sensitivity to light, sleepiness, lethargy, and skin rash. So, what is headache with nausea or vomiting? So, already right there is a sign of an infection. Definitely if it's a headache that has stiff neck. Shoot, I don't even have stiff neck on here. That's an automatic sign. So, if you have a headache with stiff neck, your child has trouble turning their neck left or right or up and down. That is with a headache. That's really bad. That is a symptom of meningitis, which you need to go to the ER immediately with your child, because meningitis will cause a whole inflammation in your brain, causing seizures. Now, seizures, it could be a tonic-clonic seizure. You start foaming in your mouth, shaking real bad. They could end up biting their tongue off, bleeding to death that way, gargling, choking on their blood, which could kill them from asphyxiation. Yeah, asphyxiation. It could kill them from asphyxiation. So it could kill them by suffocation, asphyxiation. It could kill them by blood loss. It could kill them from brain damage. And yeah, seizures, it basically could kill them instantly if not treated, right away. So that's why to get urgent medical care with meningitis is because any of these symptoms can kill your child in just a couple of hours. So lethargy is like a lack of enthusiasm, so you can tell he's just like not in it. Severe headache that seems different than normal was already one of those big signs. I don't feel good. Yeah, so skin rash, that's also a sign too. Meningitis complications, brain damage, seizure, hearing loss, buildup of fluid between the brain and skull, which could cause a brain abscess, I'm pretty sure. But right there, buildup of fluid. If you don't get that treated carefully, carefully and instantly, then you could die. In just a matter of hours. So it's just a matter of hours till this kills you. Okay, so let's go to learning disabilities. So, what is a learning disability? Basically, they have difficulty learning that specific subject or learning anything for that matter, and loss of memory. So, if you lose your memory, that's because of meningitis. Your brain gives you the memories. It can cause loss of memory. How many get it? Very rare. Fewer than 20,000 cases per year in the U.S. So, if you get headaches that are severe and you don't know what it's from, get it checked. If it's, something that lasts forever. If you stress out like me and get bad headaches, it's anxiety or stress. Rabies. A viral disease which spreads by saliva of infected animals and leads to brain inflammation. So bats are mainly one of the causes, dogs and humans. So dogs, right here, you can see there's foaming of the mouth. Now, if you see any animal or human foaming from the mouth, either that's a symptom of a seizure, or that's a symptom that they are basically having rabies and you need to get away from them immediately. Also, if they start barking or trying to snap at you and try to bite you, because if they bite you and they're infected with rabies, it gets into your flesh, it gets into your system, which will give you the same thing known as rabies. And rabies could kill you in under a week and under 5 days. So it is very, very serious. We'll say 5 days or a week, but it will kill you in a very painful yet really slowly, painfully way. And it's not something you want to fully mess with. So you can see humans. I put a human guy, normal guy over here. The humans can also have this, which they could get. A bat could bite a dog. The dog gets infected, bites the human. The human bites the dog, bites the bat, or something like that. But bats are one of the only things that basically will give it. Now, a dog doesn't automatically get rabies. Dogs have to be in contact with something that has rabies. Either eat, lick that saliva or get bit by the thing that has rabies. Then, if they bite you, then you need a rabies shot. So they see that to actually block the infection from happening. Rabies signs. The first are flu-like symptoms: fever, headache, anxiety, sore throat, and cough. Then follows a neurological period. Aggression, convulsions, hypersalivation, which means foaming from the mouth. Hydrophobia, which means a fear of water. Hallucinations, paralysis, and hyperventilation. I know it's going to be a scary thing if you've ever experienced it. I never, thank God. But seeing somebody, going through this process would be absolutely terrifying the hell out of me. Excuse my language, but it would, because you don't know when he could snap and bite your neck off. It's very, scary. Rabies causes, they include, it is caused by rabies virus, which affects the central nervous system, spreads by bites of rabid animals like dogs, coyotes, raccoons. The virus is present in saliva, therefore transmission is possible through saliva, which it comes in contact with the open wound. Rarely, the virus can be transmitted through tissue or organ transplantation. Rabies symptoms: fever, headache, and anxiety, sore throat, and cough. All the same things you can see. Final stage is coma, which leads to death. Rabies complication: myocarditis, which is part of the heart. Respiratory distress, acute renal failure, gastrointestinal hemorrhage, and yeah. How many get it? Very rare. Fewer than 20,000 cases per year in the U.S. Our last one, tuberculosis. Tuberculosis is a serious illness that mainly affects the lungs. The germs that cause tuberculosis are a type of bacteria. Tuberculosis can spread when a person with the illness coughs, sneezes, or sings. Tuberculosis symptoms: persistent cough which lasts for more than 2 weeks, cough with blood and sputum, fever or for more than 2 weeks, pain in chest, weight loss, night sweats, loss of appetite. Tuberculosis causes diabetes, chronic kidney diseases, cancer, HIV, and AIDS. HIV is a you know what I mean. Complications: coughing up blood and sputum, pleurisy, which can cause pain during breathing, pleural effusion, accumulation of fluid in lungs, lung function damage, cardiac tamponade, laryngitis, what is pleural effusion, an SF collection of fluid in the pleural cavity, the filled up fluid-filled space that surrounds the lungs, which is cardiac tamponade, compression of the heart due to fluid buildup in the sac surrounding the heart. Laryngitis is inflammation of your voice box. Larynx for overuse, irritation, or infection. How many get this tuberculosis? It's very rare. I forgot to put that there. Thanks for watching, guys. I hope you enjoyed this really long video. I see you on the next one. Goodbye.